going to pin Dr. After. So even though when you put the cameras on, when it's recorded, only Dr. Avtar Singh will be visible. So that's why you invited to put the cameras on, but you shouldn't be able to be visible when the recording will be played by other viewers. So over to you, Dr. Aftar.
Oh, thank you very much. The very important subject, respiratory system in our body, is the main and very, very important to keep them healthy. And what it doing in our body, what is the important part of the body, what is the importance from the respiratory system. Without that one, human don't have any life. This one is the main system nature make to keep the persons alive and healthy. If we look after that one, then automatically our organs are healthy and we are free from many, many diseases, many health problems. This one, how they work that one, most of people know nowadays. Main system of respiratory system is working to give the body oxygen, taking from the nature, and exchange oxygen to throw out from the body carbon dioxide. All the rubbish from the body, what they can do it from the oxygen, when the oxygen circulate everywhere in the body, and that one all rubbish in the body, which one is can't go through the urine and bowel movement from the muscles, from the other organs, keep the cells healthy. We have to be look after, we have to be very careful how we looking after our lungs. That's the most important organ. All these cells in our body need oxygen to work and stay healthy, and other organ work properly. And after, if our system respiratory is not working properly, then we can't get enough oxygen for body, what body need, especially heart. And heart can become in very big problem. If the air is not clear, that's the problem. That is an in respiratory system is not only breathing in system, our lungs, we have to be keep healthy to provide the oxygen and healthy cell to our muscles, body, other organs, everywhere you name it. The people, if they don't look after proper the which kind of breathing they're doing, what kind of they eating, how they looking after their system, then they become in the problem. This is the problem. Many people not completely bother what they eating. If the weather come bad, they say, okay, no problem, we're going for 2 minutes out. And if we give that too much cold weather to our lungs can become the problem. The mucus can build up there. More mucus build up there, more problem come. There is certain limit of the moisture should be stay in our lungs. all the lungs pockets, which one is the system we have the millions of the inside the pockets in our lungs. They have the pocket who cleaning our system. If we don't look after that one, then is they need the moisture to work that one. And when the inhaling or exhaling the air from the body, we should very careful what kind of the atmosphere we living, what kind of the air we have. We have to look after that air and other all our food, what we drinking, how cold we drinking. If they have any problem, that must stay away to stop the very cold, because in our body, all the air coming from outside, they already cold. They know that our body system is always stay 36 to between 37 body temperature, and also lot of the water in our lungs and the blood, they need to be take the oxygen and mix up and go to the other system of the body. When we properly look after, then is go everything smoothly. If we don't look after properly our system, what we breathing, what we eating, which way we, if we do some exercise, there's so many exercise for the healthy people. If you want to stay healthy, do some exercise, drink the nice water, enough water to for your body what you need, and eat properly and sleep properly, give the rest properly to your lungs and to your brain system. After that one, respiratory system is keep healthy. You don't have any problem in the body, because all the cells take the proper oxygen and supply in your whole body to look after. But problem is, when the problem come, that is also big. The people are thinking, oh, it's okay. It's not the big problem, not the big issue. But it's a big issue. If you start coughing again and again, throat become dry, or mucus coming again and again, that's mean your pocket of your lungs, they have the million pockets in our lungs, very small. They like they stain the air from there, and any rubbish they go to the out with the, when we taking our breath out, and all the carbon dioxide go out. We in the yoga they have the exercises, and but that exercise is only when you are healthy. If you're doing regularly some yoga exercise, there's some other, maybe other therapy there's telling that one. Only my mean to say this one, keep your respiratory system strong if you want to stay healthy. Otherwise, the problem, when you get the problem, when you damage your respiratory system, doesn't matter which part, so many part of the respiratory system, and not only one part working together. They have the big system, and anything, keep the sign, straight away take something, medicine, contact your doctor, contact anybody who is specialist. Then this is not the big problem, a big thing. If you think the big thing, not big thing, then is problem. Many people within few days they got the pneumonia, they got the big problem, then they take long time to cure that one. So respiratory system should be more important than heart, because the heart depend on the respiratory system. Only heart get the oxygen if respiratory system, our lungs are working properly. If lungs are not working properly, our heart becomes slow, and heart become in the trouble. When heart become in the trouble, all the body organs, all the body muscle, all the anything you name it in the body part, they start suffering. Brain starts suffering. So we have to be very careful, take care of the respiratory system to not become in the problem. So this is the most important, our body system. Many people, why they're getting so many very quickly flu, very quickly cough and other system, and because lungs is only part where the very quickly infection can come there. That infection means gives you the big problem later on. If the again and again that infection come into your lungs, person should have to be very careful. Don't ignore it. And especially in the winter. So many, you can get if the winter very quickly, many people get the big problem, pneumonia or any other things like this one, and viruses come attack very quickly. And also immune system become very low. If immune system cells don't have the enough oxygen in their body, they can't protect the other organs in the system. So respiratory system, you have to be look after very well, and not any neglect anything if you get in the problem. The working, this one, we told this one, this is the main organ to provide the oxygen in the blood. And also, if they working, if you have any problem, like so many people have the smoking system, many people are alcohol system, many people, then their lungs are working in the on the road all the time. On this one, when you're going on the road, you should wear some mask. Okay, on their pollutions are not very good everywhere now. Polluted air is polluting. To keep protection from them, if you have any, you think your lungs is not very strong, how you can find the lung is not very strong, you can get very quickly short breath. Short breath is the first sign. If you climbing that stairs, if you walk fast, if you, what do you think this one is? If you need to little run, oh, I can't run, I'll go short breath. That is the problem. When you get this problem, that is my first sign of, or your lungs is already have the lot of blockages. That blockage should be not there. That blockage should be clear as soon as possible. Because that pocket, small pockets, the millions pockets, and when we still can work, they can still live, but they go more than 50-60%, means you are 50% oxygen that you are not giving to the heart. Then heart valve can start damaging, and arteries become the in the system. Arteries also become the very stiff, and your body can't cope with that one. And circulation can get slow in a part of the, like even the brain or feet or the lower part of the legs, that one, maybe spine gets some problem. This only become because when we don't have inside oxygen our body. If we have enough oxygen, only you can get oxygen from the outside and through the lungs. If you through the lungs, you get the oxygen, and not lungs only can pass to the mix up with the oxygen with the blood, and blood can carry that oxygen to supply to other organs. So this is very important to protect your lungs from any kind of problem. Any kind of problem is, if they come straight away, don't waste your time, don't delay, don't go to the, you can try any remedies. I'm always say, you can, if you have anything, you can ask the chemist or anything. But if they know any get benefit, so don't waste time for long time. Long time, if you waste the time, long time, then is big problem. Then is very difficult to cure. If there's so much infection come in your lungs area have the small hole that I told you, to clearing that one. If the mucus start, they are more thick. Many people maybe have the experience, when they after 2, 3, 4 weeks, their mucus become more thick. It's very hard to come out. That means your lungs is already nearly 30, 40, 50% is blocked. And thick mucus means you are that small pockets who giving the air pressure to like a balloons to work the oxygen, take the oxygen property and give the oxygen to heart, that's mean they are all not working properly. Your lungs is maybe working only, not working 30-40%, only working 40-50%. Then heart need the full. Nature make our organs according to our body. If the lungs not mean, if the 50% lungs go to the problem and heart don't get the stain or anything, definitely get the stain. Whole body gets the problem. Our body, nature made it, all our organ according to what our body need. And also this is very important means you have to be careful. When you got this kind of situation in your lungs, straight away, you have to be, as I told you before, go and find out some solution. Where you can find the solution, there's so many ways. You can ask your doctor, you can ask a private doctor, anybody. Don't waste time, as I told you, on the home remedies. Home remedies you can try few days, not so long. Otherwise, big problems come. So this is the respiratory system is most important system. How you can protect, as I told you, and what they do it. There's a very big system on this one, but it's enough to understand to what very this respiratory system, how important for the everyone. So if we look after, then we stay healthy, as I told you before. So system only work when we look after them. And when we look after them, then we can stay healthy. So any other problem for the respiratory system, there is so many kind of problem, but they not come straight away in the first stage. First stage, we damage the first of lungs, then the other problems come on this one. I have the system as a Ila, you know, your partner system is when our lungs, more mucus come in our body, when it starts storing the mucus in our lungs, then our lungs becoming heavy, more and more heavy. All the muscles of the lungs, why they become the weak? The reason, like a one bag balloon only need the water, for example, 500 gram. When other mucus come and becoming thick and thick, become the big. And if you put it the same balloon quantity or 1 liter, more than 1 liter, then muscle become loose. Once muscle become loose, the oxygen not have inside the body enough, the slowly they start damage. They collapse. That is the theory of the, because every organ also have the some limit of the how much pressure that one can take it. In our lungs, we have only oxygen and water and blood. Oxygen make and supply to the body, but water is very important to purify the our oxygen air from the outside come to your body. That water, if there's too much water there, that reason people start mixing again and again, they build up again and again. Why? Because water, when the blood come into our lungs, they're carrying the water, and water starts there more thick, becoming thick, and then it can't supply the blood come thick to go when to go to the heart. So that blood water is staying there, not going with the blood. That when they're staying too long there, then they blockage all the pockets of the lungs. When they pocket that, then breathing problems start. Then they start an infection there. When the infection start, people get the pneumonia, people get the other kind of the related to the so many problems, respiratory diseases on come that one. So this one is very important to keep it healthy blood, okay? and healthy air, healthy eating. That is the important. The lungs can never give the problem. Lungs is very strong organ in our body. To looking after other organs is very strong organ. You can see the people when they have the lung is strong, they can run very fast. They can do the every job, never become the tired. Only become the people tired when they not have oxygen inside body. What is the how can they get the oxygen? Only from the lungs, from the outside. They know any system in our body we can give the artificial oxygen. They have the system in the hospital that in they give the oxygen cylinder, but natural way to provide the oxygen. The only the lungs is source of the oxygen, and lungs is only source of the take the carbon dioxide out from the body. Is both is lungs for both way is very big system and very important and very intelligent system. But when we not look after the system properly, our lungs and what we taking smoking or anything, which area we living, we're not protecting our nose and mouth, then the lot of things go in our in the system, lungs, windpipe, and they start blocking the lungs. If you want to work somewhere, people are working always that is wear the mask, wear some protection. Why? Because everybody know lungs is, if lungs is not working, there's no life then. Only a breath, if come inside, then we are living. If the breath stop coming inside, how can we throw it out anything outside from our body? So that is the main source of our living, our life, to healthy breathing. Healthy breathing, keep our lungs healthy. Our lungs, if healthy, then our heart is healthy. If heart is healthy, our all the organ getting enough oxygen, enough protection for other organs, brain, everything. So very, very important we have to be keep our lungs, is respiratory system healthy. If anything, I think it's enough. If anybody want to ask me any questions or anything about it there, I am happy to give the answers that one. Hello. And you have the, if you can do it, you know that your partner have the very big lungs problem. What I give the exercise, we already put in the cure and Siddha cure and care group, that one. Many people can see that one. If they are not healthy, if you are your lungs is not very strong, you can still do little exercise, very small exercise, but should be under supervision of some professionals. Don't do yourself anything. Many people, there's a little thing, you know, that one, we can't mention the name. And the one person you referred that person to me, and he have the more bigger problem than Mike. And somebody recommended them, oh, do the yoga. And they start yoga, they give them Kapalbhati or exercise to them in the yoga classes. And he collapsed there in the class. And after that one, I asked him, who told you this one? And I don't want to use that word, okay, but I use with him. And but this is the very important. When you take, if you have the lungs problem, don't do big exercise. Don't do any exercise. Better you ask your coach who teaching you yoga, tell him, I have this problem. Is suitable for this one or not? They are all professional yoga teachers are very good, but sometimes we not do the communicate with them, not telling them properly. Please, if somebody have the respiratory system problem, yoga is very good. So many exercises in yoga, they can make the lungs more healthy. But is ask your coach, ask your yoga teacher, can I do this one or not? All professional yoga teachers, I respect them. They're doing their great job. They know how to work. Go to the, and they can tell you. If they not tell you, you take the first treatment. After that one, you can do that one. Like you have the experience for the Michael, and the first day only he can do the 5 or 6 times. I don't know how 40, 45 last time he told me he can do in that exercise. The same exercise, but slowly his lung is built up. Don't rush it, please. Don't try to solve this. If you make the damage too much, don't try to solve the problem within days. Can't solve the problem with the days. Because, you need to be build up muscle again, clean that pockets from the all the rubbish, all the mucus from there. Should be any physician who can clear first your system, then you can inhale anything. Otherwise, it's become the don't rush it. I always say to anybody in your area, you can tell your doctor, he can give you something, or if you want to, in Ayurveda, we do, you know, that when we're doing so many cases, this one, but I never say do anything. I say keep rest, avoid anything. Many diet can reduce the mucus from the body. If there's too much mucus is go there, you have to be clean your lungs first. Which way you cleaning, only you need good professional who can tell you, okay, we can clean this one, and make sure he is the professional, and he have some good reputation, and he do the proper job. Even I tell many times, if any physician you seen that one, if the 1 or 2 days not any feel better, you feel uncomfortable, stop that one doing. For me, the patients are most important. You have to be protect yourself. Okay, so this is the way to protect the lungs. Then this is the, I think nowadays this morning I think Neha is busy or something. Maybe I don't know where that spoken yesterday, and she told me that there's some virus is coming again. They already disclose that one, and please be careful. If people have some lungs problem, they definitely have to be where the when they're speaking with somebody. Not the I never recommend. On the COVID time, I treated more than 130 patients, all type of variant. Still, I have the 4 or 5 patients came to me for the COVID. I treated them same my formula which one I used 4 years ago. I told them, don't wear the mask all the time because you need the oxygen. You can wear the mask when you're speaking with somebody. Keep mask in your neck, around your neck. If you are speaking, if you are 2-3 feet away, you can do this one. Not all the time wear the mask because you need the fresh oxygen. When you wear in the mask, you can't breathing and say you breathing same inhale, same your air is you breathing, what is coming from your body. That's no good, that one. So very careful what is doing that one. So any question anybody have, I'm happy to answer.
Yes. Doctor,
Yes.
is there any connection? What is the connection between sleep apnea and the respiratory system?
There's the sleep apnea is also they have the connection. Lungs is the people, that's the infection, that one, and that infection become before the lungs become the problem. This all things are related each other, but you can't say which one is. They have to teach if the infection, what kind of infection come in your body, in your lungs. They have every infection have the different kinds of, that is treatment on that one. That one after that one is not the means you have to be the one thing to pick up. If they which kind, maybe the some he get it some or she get it from some other person.
So how is sleep apnea connected with some kind of infection then?
No, sleep apnea. I think you last episode you asked the question about that one.
No,
you
I
are
did.
Okay. You know, there's some other lady. Sleep apnea is different than, they're not related to the lungs or anything. Okay.
Uh-huh.
They are the different reason of that one. The sleep apnea is have the, maybe I told that maybe have the depression, maybe have the other thing in the body, in their life or something. Sleep apnea is according to actually more than health issue than brain. Why brain? Maybe they have the some on medications, side effects of that one, maybe family issues, and then many people can't handle. Then they not sleep so many days, maybe so many months. Then their system is disturbed. They can't sleep, or maybe long time they have on the medication for the sleeping pills. Yeah, they need to be sorted out to the proper detail what other problem he or she have in his body.
So that means it has nothing to do with the respiratory.
They can, I say, not only respiratory system is problem. Respiratory system is, if they have with the sleep apnea, mean if the breath is not taking properly, that is symptom. If sleep apnea is, if lungs is working properly, and still have the many people sleep apnea, okay? So means lungs, not the lungs problem, the other problem. That is should we find out what is the problem? Maybe many people who have the lungs problem, they can't sleep because cough is coming. If the cough is not coming, and he is okay, he drinking properly, but maybe the other issues.
Yes, I understand.
There's a simple, you can find yourself. If the cough is coming, many people, when they're walking, no cough. When they're lying or sitting, start cough. There's so many type of the, because when they're lying, the lungs maybe have the very weak, maybe his muscles very weak or lungs muscles. Then the pressuring the, maybe that person eating too much or too fat. Belly is very big. That one there, we have the our body is limited things. All things sitting. If the belly is very big, of the pressing the lungs. And lungs pressing, the already lungs are weak, or lot of, maybe he's smoking too much in the life, or maybe he's drinking too much, maybe have the diabetes, maybe have inflammation in the body. If they have too much inflammation in the body and iron level is very low, that is also one reason. If hemoglobin is low or iron level low, that is because the cell is not working properly.
So
oxygen
you
is not
iron
enough.
Level, or which other level?
What?
Iron level is low, and which other level is low?
There's not low, I say. Maybe he have the CRP level of inflammation in the body, have the somewhere else, okay, and they circulating with the blood, and the blood is not purifying properly from the lungs, and so many, there's kind of so many other protein, maybe some other they have to best way to, what is your name?
Mayuri
ji. What best way to check your blood, okay, or tell your doctor he should go to your, I don't know who's got the problem, this one. You got this problem or somebody else?
I have started getting it.
You started this. Then you can say to me, easy for me to ask the question then.
Yeah.
When you ask now openly, you have this problem. And if you have this problem, do you have any other health problem?
I suffer from asthma, but it's all under control, and I have high BP. I'm pre-diabetic. I'm not diabetic, but I'm taking care. Okay,
you have the BP, blood pressure?
Yes.
Yes. How long you have the blood pressure?
About 5 years.
5 years. Which dose you taking?
The medicine, you mean?
Yeah.
I take Delofine XL and Losartan.
Okay, the Losartan also you taking. Yeah, have you read the side effects of that one? No. I no need to you read here. I say, have you checked your side effects on that one?
Yeah, I check.
No, not now. There may be other people waiting.
Later
you check it, that one. And did you told your doctor?
I used to have a lot of dry cough. So before I started Delofine XL, I was on amlodipine.
Now,
And
I asked the others, I can't say anything because you are on the medication. I asked the question, did you told your doctor?
yes,
Okay,
yes,
what he said? Because he is checking you, looking after you. What
yes.
is
He sent me to Harefield Hospital where they did a test. I had a consultation. The consultant called me and we had a discussion about it. And because I also have acidity, so they're going to check the level of acid in the stomach.
Yeah.
They're going to take it from there.
That is, then I say maybe you have the inflammation in the body parts. Okay, so
Yes.
so that is now I say this one. This is a very simple answer, simple question. Okay, you have acidity means you have you taking any medication for the acidity?
Yes, I take
Okay,
pantoprazole.
doesn't matter what you're taking.
Yeah.
Okay, these are the things. So mean you have the BP, you have a borderline of diabetes, you have the asthma, you have 4 5 you already counted. Any other problem?
That's all.
You are overweight?
Slightly.
Okay, slightly overweight.
Yes,
And
but I'm trying to control my weight. I do exercise. I exercise a lot.
yeah,
I do
it's okay. Good
yoga
if you
and
can.
Pilates and
Yeah,
all that.
yeah, that's good thing. But this one, if you have any, do you have any problem for the family or anything like this one? You are depression, anxiety, or anything?
No, but I cope with a lot of things and situations.
Yeah, you have some. That's one thing. Try to that one. Don't take too much pressure.
Okay.
Leave the things. Give them time. Okay. Some problems you can't solve. I can't solve. Everybody have this this kind of thing. Leave them. Give them time. Try your best, but don't take internal up to your brain.
Okay. Yes.
You
You're right.
stay calm,
Yes.
because if you don't protect yourself, I don't know where from the problem is coming. I don't want to ask you. This is all private. But I always say that people have the depression, anxiety. Most of the reason when I give the medicine to them, when they come to me, I say, who giving you the problem? Maybe he don't like you. Don't try to force to somebody respect you. Don't try to force somebody look after you. You should make yourself so strong you can look after yourself and look after one other person.
Yes.
Become the positive, become the strong. Everybody can do it. Just
Yes.
need just feed in your mind.
Yes.
Once you feed in your mind, you become very strong. And you can sleep better.
Yes, I am actually like that because I don't expect anything from people. And, I was looking after myself and I was looking after my mother.
That's very good you're doing. But what I'm saying, maybe you understand or not fully. I said, keep the many people, I say, keep the limited friends.
Yes.
If somebody giving you the problem, just leave him alone.
Yes.
Because you where from you, India?
I'm from Kenya. I've been in UK for 35 years.
Okay. I don't know. I remember one of my share. I write the poetry.
Yeah.
But I write in Punjabi. I born Punjabi.
Yeah.
The meaning of that one, रिश्ते जद पत्थर हो जावन बच के रही. रिश्ते जद पत्थर हो जावन बच के रही. पत्थर दोस्त दुश्मन नहीं पहचानते. ਜਿਹੜਾ ਛੱਡ ਕੇ ਜਾਂਦਾ ਹੈ ਉਹਨੂੰ ਜਾਣ ਦੇ. ਜਿਹੜਾ ਛੱਡ ਕੇ ਜਾਂਦਾ ਹੈ ਉਹਨੂੰ ਜਾਣ ਦੇ. हर पंछी ਨੂੰ अपनी भरन उड़ान दे. लोगों के साथ ऐसे रहो कि वो क्या चाहता है. जब when you start thinking what other person want, then you are helping them. And if he or she or anybody don't want to live with you, don't want to listen to you, just let them go. Let them fly their own wing.
Yes.
When you do this one, your mind is become free because you tried your best. We only can try our best.
Yes.
We can't change anybody. If some relation start what they want to do it, let them do it. If you stop them, I call them when they become stone, but they don't have the feeling for you maybe. Let them enjoy.
Yes.
When you become keep your mind like this one, you can sleep like a baby. You don't need any medication. As I told you before, there is no any disease. Only we are suppressing the symptoms. In cancer is also, I don't say disease. Who made the cancer in our body? We have to look after that. You just sort it out. We done so many cancer patients? And I'm not treat the cancer. I treat how they come the cancer. That is the Ayurveda. We have to treat the root cause. Your depression, your anxieties, what is your root cause? If you find that root cause, everybody know when he depressed, when that is the reason he's in the depression, because what he want or she want, other person not doing.
Yes.
The simple theory. People are, I got depression, I got anxiety. I said, what for? You understand?
Yes.
Depression, if you ask them why the depression you got, what kind of depression? Then he have the maybe reason, oh, he don't listen to me, she don't listen to me, my son don't listen to me, my daughter don't listen to me, my husband don't listen to me, I have the problem. Leave them alone. You try 1, 2, 3. Then 1, 2, 3 done. I'm like that one.
Yes.
People ask me, the Elizabeth is there, realize there. She know she sent me so many patients, and this one she also coming and learning from this. I tell them, yeah, but stay healthy, and she tell you what I teach her how to stay healthy.
One of the things Dr. Aftar teaches, which I love that quote, is my life is beautiful because I make it beautiful. So that's what I like. Dr. Aftar empowers all patients to take control of themselves and be the master of your own destiny.
Yeah, master of own destiny. That is the very good thing. Ila, you learning that one slowly.
I love your compliment.
Thank you. I know you love me. God bless you. That's one. And everybody love me, Michael love me, you and everybody respect me. I really appreciate you listen to me, and you seen the result of that one. Everybody you sent to me. So depression is nothing. We make the depression like this one. What is this one? Depression, anxiety, no. Blood pressure, no. They are all we created that one. We created, how we created, we make our organ damage. Then organ can't control them. So many side effects of the medication we taking from long time. And people want to go in the second. No, you have to make your life, learn how to live with those problems. There's nothing is permanent here. No love, no death, no human being is permanent here. All one day they left us, one day we left the whole world. Just think like this one. Then you can live, you do your best. If you cheating somebody, then you have to say sorry. If you are not cheating anybody, not doing anything wrong, just you say, okay, thank you very much. God bless you. And when you need me, just call me. I'm living life like this one.
Mm.
Love everybody, respect everybody, okay? But don't hate anybody. Never. And don't try to somebody mold. People are sometimes they made like this one. They don't listen. They may be intelligent more than you and me. Just if you start thinking, I always say all people are intelligent than me. Then depression is go. No need any medication. If you don't have burden in your mind, when you make your mind clear, oh, they are clever than me, then means you are not give up, but you learn how to live with your life. You can see after that one, many of the problem in the body solve automatically because we have our nervous system very strong. Our organ and gland, they are very good system. They repair ourselves. Nature give the doctor in our body, but we make that doctor sick. Okay.
Mm.
Anything else?
Thank you.
Thank you very much. You're most welcome. Ila, if you have, if you can do it, tell about the respiratory system. What is the problem? Mike, if you want to do
So
for.
I can touch on what you said, kind of link everything as some of you already have heard, but my partner suffered with massive clot on the right entrance to his on the entrance to his right lungs.
Windpipe, yeah.
And one of the issues, Mauri, he also suffered was sleep apnea. And he had high blood pressure and gout, and the list was long. And the cleansing that Dr. Avtar has treated Michael with not only strengthened his lungs, there was also the impact on and strain on the right-hand side of his heart. So his lungs are getting stronger. His heart is in a great condition. We already had that confirmed by the doctors during the checkup. There's no issues with the heart. But amazingly, his sleep apnea has cleared as well.
Oh.
During the last full moon, I woke up in the middle of the night. I just wanted to look at the moon. And when I lied down next to him in the night, where before he would be stopping breathing and snoring really heavily,
yeah,
now he sleeps like a baby, so silently. And
so you not told me you should give me the party now, okay?
So in fact, I have to listen closely for his breathing, because it scared me that, oh my God, is he not breathing? But actually he's breathing so peacefully now. And that is because the body cleanse removed the toxins from his liver, and his blood circulation is better. So his blood, so his blood pressure has normalized, but also there's more oxygen flying to his lungs. And like Dr. Avtar said, Michael also had very low iron level, which is now in the norm, is a really healthy level now.
What was that one iron level?
I can't remember. I think it was about 6 or 8 units. It was well before the norm.
6.
And also,
yeah, 6.
Also Michael's inflammation was very high, and that body cleanse that Dr. Avtar has treated him with reduced the inflammation to the normal level within 2 weeks.
And
so
clot on the aneurysm.
What I'm trying to say, it's all connected.
Yes, I understand what you're saying.
Yeah, you understand. This is all connected, and
yes.
not one problem can make you sleep apnea, and many other things not let you brain sleep. And also there's one big problem on the aneurysm. They have the very big clot. In the allopathy, they say no one can, they never come down. Ila?
Yes, so another thing, because like I said, Michael has the long list of things. So one other things he had aortic aneurysm, which was measuring 4.5 on 3.9 centimeters. And during the last check, the size would reduce to 3.6. And we have another check in the middle of October, and we're hoping to see the further reduction. So yeah, it's really all connected.
There also kidney and PSA level was.
Yeah, there was a
Yes,
prostate
level.
problem that was slightly enlarged, and there was a gout problem. The kidneys were not functioning. There was a long list of
And
things.
also the very urgency of the urine. They can't hold the urine, this one.
Yes.
Then he started, how much he hold the urine? 600.
So after, I think, 3 weeks of treatment, he could hold to 630 milliliters. Yeah. Because he had to measure it, which was
So the CRP level, is it a measure of inflammation in the body?
yes.
Yeah.
Yes.
You have to be do the full checkup, your body.
Yes, that's what I'm going to ask my doctor, because I can really feel inflammation. Because of that, I get pain, nerve pain and all that,
Okay.
because I have degenerative discs in my spine.
If you need what kind of the blood check you need, we can send the I think already on the cure, and in that one we put it already. Neha, Dr. Neha know that one. I give the all list which one I tell my patients to do that checkup full. That is the full checkup of the body. Sometimes doctor don't do it. Okay, maybe you have to. If your doctor can do it, that's very good. Okay.
Yes, he normally knows, because I have some knowledge, so he does listen to me.
Okay, that's very good. Just send this give him that list of that one blood check. Okay, then you can find where the problem in your body.
Yeah, so I'll ask Dr. Neha to tell me where that list is.
Oh, you can find yourself already have in the. Are you member of the Siddha Ayurveda Cure and?
Sorry, what is the name of the group?
Siddha Cure and Care.
Siddha Cure and Care. Okay, fine. I'll look into this on WhatsApp.
Okay. You can otherwise, Ila, you can
Yes.
put it, or I can put it inside. Okay.
Yeah, we can add it to the group again, or you have on the chat, Muri, I have put Dr. Avtar's mobile number. You can contact Dr. Avtar directly, and he will WhatsApp it to you.
Why don't you put it on the WhatsApp, please?
Okay, we will do.
Okay, no problem.
Yeah, I will still take down his number.
Okay.
We have the number on the group. You can find my number of this one on the group. Okay. You can ask Neha can give you. Okay.
Okay.
I have added it to chat, Dr. Avtar. It's on
Okay, okay. Then you can give that one. You can chat that one. That is very, very important. That you and for the sleep apnea, you can maybe reduce what I told you, the therapy. You no need medication for that one. You have the other problem. You need medication for sleep apnea. You can 50% reduce it. What I told you. Don't think about people thinking about you.
Yes.
Don't you think what people want.
Yes.
How you don't try to make anybody happy. How old are you?
67.
Yeah, no time to make other people happy now. Try to make yourself happy.
That's true. That's very true.
Just only this word. If you like a Ila one, remember because I want same. Don't try to make other people happy now. Try to make yourself happy now. Okay, this is the time.
Yeah. Yes.
Write it down. This is the time. I have to make myself happy, not other people. Write this word, and every time morning, at least 11 time, remember, evening 11 time, remember, after lunch, remember, like do the puja, okay? like do the chanting, this one, okay?
Yes.
Chanting,
for sleep apnea, they're not going to give me any medication. They're just going to.
I told you the sleep apnea is the problem of your other problem.
Yes. So
I told you, I gave you the medicine free.
Yes.
Write it down.
Yes.
Now, I
Yes.
want to keep myself happy,
Yes.
not other people. Let them happy, what they want to do it. Okay? Look after yourself. You have to make yourself happy now. You
Yes.
have to treat yourself.
Hmm.
Okay?
Yes. Because
I think you're not treating well for yourself. Okay? You are thinking about other people too much.
okay.
Stop that one. If you stop
Yes.
that one, that is your medicine for
Yes.
sleep apnea.
Yes.
For other problem, you need to be proper checkup, proper medication.
Yes.
That's not a big problem. We treat so many people. Okay?
Yes.
All right.
And sometimes one medicine has side effects which affects other things.
I know that one, but I
Yeah.
can't comment on the allopathic medicine. Okay.
Mm-hmm.
With the Ayurveda, I do with the Ayurveda custom-made medicine. Okay.
Yeah.
We are not giving pharmaceutical companies all my medicine. Most
Yeah.
of medicine I make my own and make
Yes.
to custom-made according to person. Like I give you your problem looks like the other people to making other people happy. Try to yourself happy. I give you the one share, na? Small
Yes.
poetry. That's
Yes.
that's if you start thinking that one, ਜਿਹੜਾ ਛੱਡ ਕੇ ਜਾਂਦਾ ਉਹਨੂੰ ਜਾਣ ਦੇ.
Yeah. Yeah.
ਜੋ if somebody want to leave you, say thank you very much. When you want to me, call me. Don't put anything in your heart, any
Yes.
stain. We put the stain in our brain and heart. If you want to control, shut your door. No one can come to your home. No.
That's true.
You don't need to invite the stupid people in your life.
No.
And people who don't like you, why are you inviting them? Their whole world, you can make so many friends if you are good. But I think person no need any friend. If he don't make himself his friend, he can't make any friend from anybody in the world. First should have to be make you yourself your friend. You are your best friend.
Yes.
If you are not looking after yourself, you are your enemy. Okay?
Yes.
Okay, thank you very much.
Thank you.
I think we would also need one counseling and psychotherapy session from
hello,
you, Dr.
Captain.
Singh.
Where you disappeared today?
No, I was here all the time, but I wanted...
This is no good, okay?
No, I was listening throughout, but just on the back.
And,
but I think
any comment?
No, of course, who can comment? A wonderful session as always. But I think with this, we would love to hear more about counseling and psychotherapy from you one time on mental health, taking care of our mental and emotional health. And I think that's also from the Ayurveda perspective, as you say. So that would be lovely to look forward. And thank you, Ella, for sharing such amazing case study, which is so inspiring. So as you said in the very first session, magic ball and the magic happened.
Absolutely, definitely. Yeah, there's the thing that Dr. Avtar has taught us all, because myself and my partner and my friend goes to see him for therapy, is to take care of our lungs as if they are our wings, and for each breath they lift us higher into life, and when every inhale fuels our heart and every exhale cleanses our soul. And I think that's just a beautiful summary of what Dr. Avtar does.
Thank you very much, Raji. Okay. So thank you, Captain. You came and
yeah, there's no questions on the chat today, so if you
no
want
problem.
to wrap up Dr.
No
Avtar,
problem.
then we could wrap up and
okay, thank you very much.
Thank you, Ella. Thank you, Dr. Singh. I'll put the recording in our group very soon. Thank you, everyone.
Is the last week recording you put it on the?
No, it's still not ready, so I will put it in playlist.
Don't worry. Take I know the everything. Okay. Okay.
No, I'm on it. I will work on it.
No,
later
don't worry.
Tonight I will send.
Don't worry. Okay, you are okay.
Yes, thank you,
Very
Dr.
busy.
Singh.
I know very busy you are. Okay. Okay.